Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy with a joint faculty appointment at Ross University School of Medicine. And today I wanted to discuss about Lyme disease, and specifically a type of Lyme disease which creates something called Erythema migrans. So to make this actually correct, we're gonna use a color that makes sense. So I'm gonna replace this with actually a red sort of circular, and then in the middle there's sometimes an opening, well, not an opening, but a lightness that takes place. So this is kind of the rash all around, and this rash actually sometimes travels up to 12 inches. So here's the rash, and typically the rash is in there, but sometimes there is a clearing. Most of the times you won't see that. So I hope this kind of helps you understand the type of rash that you see in Lyme disease. So let's say exit drawing here. Exit drawing. Now looking further, a lot of times it's heat that you can feel. 70 to 80% of people with Lyme disease, so 70 to 80%, which is spread by ticks, actually will develop Erythema migrans. So this is one of the most frequent types of symptom that you see. It will usually show up at the site of the tick bite within 3 to 30 days. So it's somewhat difficult to look for patterns and look for a predictive outcome here. The bacteria are transmitted to humans through infected deer ticks. So this is a bit different. And I've seen these ticks before, and the name of the bacteria is actually Borrelia burgdorferi. So that's the closest causative agent. Now, of course, in humans, the effect is Erythema migrans, or the contraction of Lyme disease. And then I'm just going by the three things that cause epidemiological outbreaks. So that's host, agent, and environment. So we can actually talk about the environment very easily, because usually in wooded areas, and then so there's others as well. Usually this bullseye pattern is 2 inches in diameter, so it's not very big. Sometimes, as I showed you, there's a bullseye type of pattern right at the center. So you may also have additional symptoms, and these may include fever, chills, body aches, fatigue, headache, swollen lymph nodes, and even neck stiffness. So at some point, this might be more so Lyme disease rather than meningitis, like bacterial meningitis. So all you need to diagnose Lyme disease is that Erythema migrans. That can be the basis of a diagnosis. Since problem is the early blood tests, they're not very reliable. You should understand that the bullseye pattern is only present in the minority of cases. So that might be something that you might have from Lyme disease if you're lucky, because then you could be treated. But if you're not seeing anything, then that can be difficult to treat. The lesion expands over several days and may have blisters in the center. That's not common either. So you could have a blue-red oval or circle. So if there's no rash or it's going unnoticed, you don't remember maybe being bit by a tick, it can be difficult to diagnose Lyme disease. So testing early will likely show a false negative. And this is the case with some of the other diseases. Testing early in the disease process will likely show a false negative, as your body hasn't had time to develop a response that can be measured. What's the treatment? Well, doxy is good, amoxicillin. These are good antibiotics orally, and then if Lyme disease involves your central nervous system, you may need some IV antibiotics. I think preventing Lyme disease is pretty self-explanatory: insect repellents, and so wearing long clothes, things like that. But it's important to keep track of the ticks and Lyme disease, just knowing what the causative agent is and applying the host agent environment technique, and making sure you know all components of this difficult disease to have. Thank you for listening.